A new study is looking at the link between COVID-19 and the risk of heart attack or stroke. It found those who test positive may have a higher risk for cardiac events, even years after the infection. For more, let's bring in our medical specialist, Dr. Marla Shapiro. Dr. Marla, thank you as always for joining us.
So it's a fascinating study.
It is a bit concerning, too.
Well, yes and maybe no. When we look at this data, this is the data looking at people who had got COVID before the vaccine era. So think about early 2020. So when we look at the numbers that they looked at, they're looking retrospectively in terms of patients who were diagnosed as having COVID, comparing them to individuals who did not have COVID. So there were over 11,000 people who were positive for COVID-19. This is pre-vaccine, and nearly 3,000 of them were hospitalized. And then they matched them to a control population of over 220,000 people without COVID-19. Now, this is important because when you have a large control population, if you don't see it in that control population and you do see it in the study population, you're not looking at spurious risk, you're looking at a real outcome. So when you looked at the outcome of these 11,000 people who tested positive for COVID-19, and you looked at what happened to them, what we saw that there was a twofold risk of major cardiac events that persisted 3 years after the illness. And if you had COVID and were sick enough to be hospitalized, the numbers were even worse. The risk of a cardiac event was 3 times higher and higher risk for future heart attack and strokes, which sort of implies that the sicker you were, the more inflammation you have, the more long-term risk you have. Now, this is not a total shock to us because if you look at data, for example, on influenza, if you look at data on respiratory syncytial virus, if you look at data on pneumonia, we know that individuals who have these infections in the months ensuing do have higher risk for cardiovascular disease, but typically it's the months ensuing. In this study, we were looking up to 3 years that cardiovascular risk persisted. Now, remember, this is pre-vaccine, so these were the sickest of the sick. So, that was a concern. What's interesting here is that if you were an O blood type compared to A, B, or AB, we saw a lower risk of cardiac events after COVID. If you were an A or an AB, you had a higher risk of cardiovascular events. And we don't really know why that is. We don't know whether or not the gene that codes for blood type has something to do with our response of infection. For anybody, regardless of blood type, if you happen to be taking low-dose aspirin for whatever reason, your risk of a long-term cardiovascular event was lessened. So it adds to possible hypotheses as to what might be going on here.
And there's also, they mentioned in this study that they looked at people in Britain, which was predominantly white or European, so they want to go beyond this as well.
There's no question that when we look at one particular area, we wonder, is it this particular database? Probably not. It probably had to do with the severity of the COVID, the advanced inflammation of the COVID. We know in autopsy studies that we've seen the actual COVID virus within plaques in arteries. So plaques are what blocks your arteries, and it may be that pronounced inflammation destabilizes and releases the plaque, and it may have that persistent effect over 3 years. I think the good news is that in the vaccine era, we don't see the mortality that we see in the pre-vaccine era. We don't see the illness that we see. It speaks to that reason of why have vaccines, why mitigate against severe illness, hoping that we don't see this long-term cardiovascular link.
So what can people do then? Especially if you know you've had COVID already.
So I think, if you've had COVID already, we want to make sure that we're looking at your cardiovascular risk factors in general, but maybe even consider this an additional risk factor. So, we're now ending past that 3-year period of the pre-vaccine era. We're now in the post-vaccine era. But it just speaks to the fact that this may be one additional risk factor for people at high risk of cardiovascular disease. So it just adds a piece to the puzzle of one more thing we should be asking about when we're screening for cardiovascular disease.
And I think one of the big things is aspirin. It's still a huge thing for this, isn't it?
Well, in the finding, those who are on aspirin didn't have that cardiovascular event. That doesn't mean that everybody should be popping aspirin because aspirin does have side effects associated with it. They had an indication to be on it, but it did seem to be cardioprotective even in the face of overwhelming COVID. Bottom line now, I think, is remember that COVID is still prevalent. Although we see milder cases, the importance of vaccine prevention still remains.
And are we starting to see any data now that we're almost 3 years into the vaccines? Are we starting to see if that's having an impact?
So I think that data is being accumulated now to see if we still have that same cardiovascular risk. Early days, we don't have that data, but certainly we haven't had that signaling, which is reassuring.
Okay. Dr. Shapiro, thank you as always.
Thanks.
CTV's medical expert, Dr. Marla Shapiro.